Here you are, after this storied career, about to step down from this position as you go on to new adventures. And Elon Musk tweets out, his pronouns are prosecute Fauci. So he's describing you as a criminal who you should be prosecuted. And how do you feel when someone with that big a megaphone labels you a criminal?
Well, to be honest with you, Andrea, I don't pay attention to that. I mean, yeah, he has a big megaphone, but I mean, the Twitter sphere as it is has really gone berserk lately. It's got to become almost a cesspool of misinformation. So you're really not even sure what he said, but I don't pay attention. I don't have a Twitter account. I don't tweet, and I don't listen to tweets. So whatever he said, I'm not paying attention to it.
You had plenty of defenders. John Brennan, the former CIA director, says Dr. Fauci is a national hero who will be remembered for generations to come for his innate goodness and many contributions to public health. Despite your business success, he said to Elon Musk, you will be remembered for fueling public hate and divisions.
Right.
I mean, but the real impact of the public hate and the divisions, the politicization of public health,
that's bad,
is really something that you've had to deal with.
Well, I've had to deal with, and even though I don't listen to or bothered with those strange, bizarre tweets like prosecute me for what? I mean, I don't know what he's thinking about. What it does is it really is turns people away. I'm afraid younger individuals who are interested in getting into public health might say, what is all this about, where public health officials who are doing nothing more or less than trying to save people's lives by promoting good public health principles get attacked for reasons that seem inexplicable. So it really is, I believe, Andrea, a manifestation of the profound divisiveness which we have in our society right now and the politicization of science, which leads to absurd statements like that.
Your life has been threatened. There have been death threats against your family, your wife, your children. What is it like to live under that when you know that what you're trying to do is advance public health and save lives?
Yeah. Well, it seems rather paradoxical that that's the situation. I mean, obviously, it is not at all pleasant. Yes, my life is being threatened. The thing that bothers me most is the preposterous nature of harassing and threatening my wife and my children. I mean, what kind of a coward does that, to threaten and harass the children, the innocent children of a person who's a health official and the wife of a person who's, I mean, to what end? It really just is a manifestation of how bizarre our society has gotten.
And the society is now facing real threats. There's a triple threat. There's COVID, there's the flu, there's RSV. People aren't getting the flu vaccine as much as they should. Do you think that's the result of the politicization of COVID?
Well, I think that the idea that people who otherwise you would expect to get vaccinated are not getting vaccinated, a lot of it, as we know, is related to ideological persuasion. I mean, it's no secret that if you look at red states versus blue states, that the red states are under-vaccinated and the blue states are much more vaccinated. If you look at the deaths among unvaccinated and vaccinated people, the unvaccinated are very, very much highly weighed towards hospitalization and death than the vaccinated individuals and vaccinated in both. And there's a preponderance of one political persuasion in one group versus the other. I feel badly for that because as a physician and a scientist, I don't want to see anybody suffer. I don't want to see anybody die from an infectious disease that's preventable. And that's the thing. We have a vaccine that can save people's lives, and people are not using it for reasons that have nothing to do with good public health principles, but have to do with political ideology. That is crazy.
And is the fact that people are not getting the flu shot, which used to be an automatic thing for most people.
It's a spillover effect.
Is that a spillover? Is that
it's a spillover. And it's a spillover effect to influenza. We're not getting as many people at this point in time vaccinated with flu as we've had in previous years. But I'm even more afraid it's going to spill over into the childhood vaccinations, the measles, mumps, rubella, and things like that. That would be a terrible tragedy.
So you're standing next to the president in all of these COVID briefings. How difficult is it for you when you hear him saying things that you know are not accurate about public health?
Well, it's difficult because I have a great deal of respect for the office of presidency of the United States, as I do for all government institutions. But I felt I just had to speak up against and contradict what he said, not only for my own professional and personal integrity, but my responsibility to the American public when you hear things being said that are just not true. The people on the far right somehow construe that I enjoyed that I was trying to undermine him. I didn't enjoy that at all. I just felt very uncomfortable, but I had to do it.
When you hear the President of the United States promoting hydroxychloroquine for COVID,
right,
and listening to advisors like a doctor from California and his trade advisor, and the government, the federal government spending, according to some reports, $20 million to buy that, stockpile it for COVID. What can you do in your role?
Speak up like I did. And it didn't help much because he just kept on doing what he wanted to do. But it had the result of creating a phenomenal amount of hostility against me among the people around him, which has spilled over into the people who are very much listening to everything that he has said. And that has made it very uncomfortable, the reason why I'm getting so many threats against me.
Do you think that lives were lost because of the way all of this became so polarized?
When I say things like that, it gets thrown out of proportion in sound bites. But the fact is, vaccines save lives. If you say something or do something to dissuade people from getting vaccinated, then lives will unnecessarily be lost. That's just a fact.
And masks.
Same thing. Masks, physical distancing, all the things that are good public health principles.
When you look back now, is there something you think you could have done differently to avoid this polarization?
Well, I don't think I could have done anything to avoid politicization and the profound degree of divisiveness in society. I always try to examine, is there anything I could have done differently? Because certainly nobody's perfect, least of all me, that's for sure. So I look back, maybe we could have been explaining a little bit more carefully about the scientific process, that things change, that as the virus evolves, January is different than February, then different from March. So if had we known in January what we knew in April, May, June, and July, we may have said or done things differently. That's following the information that you have it at the time. That gets interpreted and distorted by some as the scientists are flip-flopping. We're not flip-flopping. We're going with the data we happen to have. And one of the beauties of science is the flexibility. It's a self-correcting process. When you get information that counters some of the information you had earlier, you've got to go with the most accurate and correct and up-to-date information.